Professor Zaman Sheikh, which will be in continuum of the diabetes program.
Thank you very much, Dr. Sanam Shah. I'm grateful to Dr. Sanam Shah, Dr. Ghafoor Shoro, Dr. Shaila Naseem for organizing this wonderful scientific session. And today is my topic on gonads and reproductive system and men's health in relation with diabetes. So actually there are two lectures. One is polycystic ovarian syndrome. From female I have chosen most common polycystic ovarian syndrome. And from men I have chosen ED with reference to diabetic hypogonadism. So I will cover gonads of both male and female today in half an hour. 50% time given to polycystic ovarian syndrome and rest of 30 minutes given to male hypogonadism. Both are very common disease. So first of all, endometrial proliferation, it causes metaplasia and become cancer. And even CA breast, the prevalence is more. And increased risk of not only CVD but peripheral vascular disease, all we see in type 2 diabetes. Hypertension and hyperdyslipidemia will be there. Increased risk of diabetes in these patients. What is the pathophysiology? Really we don't know. It is mysterious, it is complicated, it is multifactorial. But follicle ripen prematurely and come into atresia before stage where healthy oocyte can be sustained. They become atrophied. Granulosa cells grow abnormally slow and their cell death may contribute to the atresia. So sometimes we give clomifene to ripe these follicles. Two scientists, they were gynecologists, Stein and Leventhal, because they were dealing at that time these type of females. And so initially it was named Stein-Leventhal syndrome. When I was medical student, only this was the name. Then polycystic ovarian syndrome name came. And now it will abolish in future. Okay, etiology and pathophysiology, it is a vicious cycle. Actually, problem is in the hypothalamus. Gonadotrophin releasing hormone is increasing more. And actually, it should increase both LH and FSH. But LH is raised and FSH is inhibited by different mechanism. So there is mismatch between LH and FSH, and normally ratio is 2 to 1, more than 2 to 1. Not always, not in 100% of cases, but mostly. So excess LH and comparatively low. It is not very low, minimum 0.00, no, comparatively low. Hypersecretion of androgens disrupt follicle maturation and it becomes substrate for the peripheral aromatization. It becomes, part of it becomes dihydrotestosterone causing hirsutism, part of it acts on the hair follicle causing alopecia, and part of it becomes estrogen. And this is the reason that these females are well estrogenized. Their estrogen perfect normal, even more than normal. Feedback on pituitary causing decreased FSH secretion, and insulin resistance will cause elevated insulin levels. Okay, ovaries, they are enlarged and are polycystic, as I mentioned. Endometrium, lack of ovulation for an extended period of time may cause excessive thickening of the endometrium, and this may be carcinogenic, precancerous condition. Okay, this is gross picture and this is ultrasonographic picture, typical, not always seen, and it doesn't mean that polycystic syndrome is always present. It is suggestion. So what are the symptoms? Irregular or deficient periods, oligomenorrhea. Women will have spotty period, one every couple of months. So most of the time it is scanty or even absent. In some women, altogether absent. Body weight. This is central obesity, so body weight is very important. Not in 100% of cases, but in majority of cases it is present. This is hirsutism. What is difference between hypertrichotism, hirsutism and virilization? These three terms are used sometimes synonymously, but they are not same. They are totally different. So anybody? It is hirsutism, androgenic, dadi mooch. है ना, typical. But other androgenic like below umbilicus, no hair in female. Female pubic hair are triangular. In male, always like diamond shape, starting from the umbilicus. In female, if there are thick coarse hair below umbilicus, means hirsutism. In breast, in female, they are not there, hair not there, only in male. Male are hairy. In female, breast hair, yes, hirsutism. So this is hirsutism. And what is hypertrichotism? Hypertrichotism is overgrowth of hair all over body. एक रीच की शक्ल याद करें, रीच, उसको हर जगह बाल होते हैं. And the causes is not testosterone there. Causes is either genetic, familial, or maybe some drugs like some minoxidil type drugs which was once used for hypertension, and phenytoin sodium type things. They can cause hypertrichotism. And what is virilization? It is extreme degree of hirsutism, extreme. So when virilization is there, means maybe cancer in the adrenal gland, maybe carcinogen, because this is extreme degree of testosterone secretion, excess. Or it may be congenital adrenal hyperplasia. Only few conditions can cause this virilization. Normally they are can't do, even if you wear burqa in a male female, you can distinguish this is male female. How? Because in male shoulders are short. Other way around. In female shoulders are short, hips are broad, they're broad. And in male broad shoulders, hip is small. So even if you wear burqa, ये किसी ने बजरंगी भाईजान देखी है ना, सुलेमान खान का बुर्का, पता चलता है सुलेमान खान छुपा हुआ है पहाड़ जैसा, तो औरत लगती नहीं है. तो बहरहाल, अच्छा, even if a person walks under burqa, you will come to know who is male, who is female. क्योंकि ट्विस्ट होता है फीमेल बॉडी में, मेल फौजियों की तरह चलते रहते हैं, तो यू कैन डिस्टिंग्विश. बट इन विरुलाइजेशन यू कैन नॉट डिस्टिंग्विश. कॉन्टूर्स, चाल ढाल सब बदल जाती है. इवन वॉइस चेंजेस, मर्दाना वॉइस, भारी वॉइस. ये मेल बाल्डनेस, मर्दाना वजहत होती है मर्दों को, या टेम्पोरल बाल्डनेस औरतों में नहीं होती. ऐसे लगता है हमेशा विग पहने होती हैं, मगर उनमें अगर मर्दाना वजहत आ जाए, टेम्पोरल बाल्डनेस, सो दिस इज विरुलाइजेशन. केलाइटोरोमेगाली अगर बहुत ज्यादा हो तो दिस इज साइन ऑफ विरुलाइजेशन. सो विरुलाइजेशन इज वेरी सीरियस सिचुएशन. हियर यू डोंट सी विरुलाइजेशन, यू सी हिर्सुटिज्म, एक्सेसिव बॉडी हेयर, जैसे बता दिया हमने. ओके जी. देन एक्ने, दे ऑल गो टुगेदर. And because women with polycystic, they are producing more male hormone, they produces more sebum, oily substance, and causes blocked pores and causes acne. Alopecia, especially temporal baldness थोड़ी बहुत हो जाती है. Alopecia अगर हो तो thyroid dysfunction, polycystic ovarian, every cause of testosterone excess plus iron deficiency, vitamin deficiency, and some local causes. Then acanthosis nigricans. I think if this is present, you don't do serum insulin because it is marker of the insulin resistance, and you have to give metformin then in polycystic ovarian syndrome. So how you diagnose? Basal body temperature, old gold हमारा भाई 1 degree centigrade बढ़ जाता है after ovulation. Ask patient to test to see ovulation is occurring or not. Ultrasonographic picture which I mentioned. Endometrial biopsy, sometime we need before periods to reveal proliferative glands. And LH-FSH, especially ratio. E2 means estradiol, estrogen, prolactin थोड़ा ज़्यादा होता है. Don't treat hyperprolactinemia or polycystic ovarian syndrome. It is part of this syndrome. Testosterone, especially free testosterone or androgen index, आजकल free androgen index होती है लेबोरेटरी में. And then insulin. Sometime laparoscopy is needed. So how you will treat final part of polycystic ovarian syndrome? It depends. ये एक अजीब बीमारी है जिस पे डिपेंड करता है. किस पे डिपेंड करता है? औरत की ख्वाहिश पे, उसकी विल पे. बता तेरी रजा क्या है? औरत से हम पूछते हैं, तुम्हारी रजा फर्टिलिटी है या तुम्हारी ख्वाहिश ये है कि ये जो हर्सुटिज्म हो गया है, डिप्रेसिंग, एम्प्रेसिंग, उससे जान छुड़ानी है, अलग अलग ट्रीटमेंट है. द ट्रीटमेंट विच यू गिव फॉर हर्सुटिज्म इज कंट्राइंडिकेटेड फॉर फर्टिलिटी, एंड द ट्रीटमेंट विच यू गिव फॉर फर्टिलिटी इज कंट्राइंडिकेटेड इन other part of the syndrome. If pregnancy is desired, अगर fertility चाहिए तो फिर एंटी एस्ट्रोजन ड्रग दे दें. क्लोमिफेन इज ओल्ड गोल्ड. Nowadays gonadotropin available, और luckily ये recombinant FSH is available, 75 units intramuscular, 11 injection from day 2-3 of the periods, continue for 11 and then stop, then next month repeat the cycle. It will induce ovulation. So it's a comparatively new therapy now available in Pakistan. Insulin lowering agent, only agent is metformin. Anti-androgens, we have got one is spironolactone, very cheap, commonly used, 25 milligram 3 times a day is usual dose. Sometimes we can increase. Other is Endroker. Endroker 50 milligram का आता है और वो देते हैं, मगर Endroker देने से फिर प्रेगनेंसी का न करें फिलहाल. It is very potent anti-androgen. Then gonadotropin releasing hormone agonist sometimes we use. Now if pregnancy is not desired and problem is cosmetic, so beside cosmetic treatment you give this now you can give Diane type of thing, Diane 35 या ओरल कंट्रासेप्टिव. डायन इस क्यों बेहतरीन है? क्योंकि इसमें प्रोजेस्टेरॉन की जगह सिप्रोटेरोन डाला है, एंड्रोकर, जो 2 मिलीग्राम है, हालांकि लो डोज है. 50 मिलीग्राम की अलग टेबलेट भी आती है, मगर इट इज पोटेंट नॉट ओनली प्रोजेस्टेरॉन बट इट इज एंटी एंड्रोजन एज वेल. उसका डबल एक्शन है. और अगर बहुत ज्यादा हर्सुटिज्म है तो गिव एंड्रोकर टेबलेट, Ciproterone 50 milligram for first 10 days of cycle and continue Diane for 21 days. For 7 days no treatment. Again next cycle both, one for 10 days, other for 21 days, continue cycle. Okay, then insulin lowering agent तो हर एक में दें, चाहे जो भी ख्वाहिश हो खातून की. और anti androgen can be used but as soon as pregnancy stop. So long term effect क्या है? Sequences, consequences, infertility. Many women experience infertility while having polycystic ovarian syndrome. Many will have to go to fertility doctors to conceive. To conceive, women with polycystic have to learn to monitor ovulation by taking their basal body temperature and examining cervical mucus. Okay, long-term effect include, as I already mentioned, and again repeating because they are important. There is strong evidence that finds women with polycystic ovarian syndrome at high risk of all these things: metabolic syndrome, type 2 diabetes, hypertension, dyslipidemia, cardiovascular disease, even peripheral vascular disease. Increased risk of endometrial cancer, never forget. End of polycystic ovarian syndrome in half an hour. Before half an hour I finished. And now this is the beginning of the second part. And it is diabetes and male reproductive health. Questions will be invited at the end. Okay, so what health problems are caused by diabetes? We know microvascular disease, infections, metabolic disease, hyperuricemia, dyslipidemia, uremia and so on. Can cause blindness, kidney failure, nerve damage, ischemia that may lead to lower limb amputation. Can increase chances of CVD, cardiovascular disease, and cerebrovascular disease. Now, besides these, there are other important complications. They are high chances of developing sexual and reproductive health problems, which include erectile dysfunction, androgen deficiency, low libido, sexual desire, premature ejaculation, retrograde ejaculation, balanitis, tinea curotis. Now I will not focus all of them. I will focus mainly on these two things: ED and androgen deficiency and libido. First three things, because they are different things. Everything is different. Even ED is different. ED means erection, and to me sense means stiffness. These are two different things. Everything is different. Combined we say impotency or erectile dysfunction, but it has got so many components, starting from libido. Retrograde ejaculation, I should, what happened actually? Acha, retrograde ejaculation, very, Radshela, welcome. Okay. Retrograde ejaculation, I may talk only one or two sentences, very common, autonomic dysfunction, autonomic neuropathy. Instead of going forward, semen goes backwards because of loose sphincter and antiperistaltic movement. So it causes two problems. One is subfertility. If sperm content is less, fertility will be less, obviously. It is like oligospermia. And number two, satisfaction is not there. Satisfaction occurs when there is full ejaculation and orgasm. It is not there because semen goes upwards. So male is not satisfied, woman is not satisfied. Two problems. Diagnosis very easy, very easy. What is the diagnosis? How you will confirm? By simple test. Retrograde ejaculation. Urine TR in the first thing in the morning, full of sperm, very simple. And unfortunately, no satisfactory treatment is available because it is a late stage autonomic neuropathy, but some drugs might help. Okay, then balanitis infection, they need good hygiene. It is infection of the tip of the organ and this antibiotics. Tinea cruris, genital area fungal infection, antifungal infection, maybe oral, maybe local. So these three are easy. Premature ejaculation is part of this. Some techniques are there, and then some drugs are there. Some SSRI, they are found helpful in premature ejaculation. So I finished these four, and now I will talk ED, androgen deficiency, and libido. ED is when a man is, there are so many definitions. In every book you will find different definition. But ED is when a man is unable to get or keep an erection that allows sexual activity with penetration. So it is a problem, now it is a disease in which patient is one, but sufferer is not he. Sufferer is partner. Strange disease. बीमार और है और नुकसान दूसरे को हो रहा है फीमेल पार्टनर स्टेंट डिजीज सो टू लाइफ्स आर एसोसिएटेड very emotional problem, very sentimental problem, very common problem, I tell you. Don't feel shy, please, in asking patient if there is problem, but they need privacy and they need some time. Without proper time, without privacy, they will not tell their problem. It's very common. So sometimes you have to ask, भाई कोई कमजोरी है तो कौन सी कमजोरी? They will tell you in detail, and they will give you a lot of money. Don't worry about money because they are ready to spend any amount of money. You give them time, they will give you money, no problem. Okay, a symptom of person can suicide की tendency होती है. देखो ना, उर्दू में कहते हैं ना मर्द, यानी वो मर्द ही नहीं है. देखे ना, किसी बीमारी में ये यानी तुहमत नहीं लगाते कि तुम तो मर्द ही नहीं हो. भाई मैं मर्द हूँ, नहीं तुम नहीं हो, ना मर्द हो, नाम ही ना मर्द रख दिया है. ये सच एन इमोशनल कंपोनेंट. A symptom of some other problem, either physical or psychological. How common is ED with diabetes? Up to the very common condition, I tell you, in diabetes. Up to 4 in every 5 men with diabetes may eventually, not at the time of your appointment, eventually experience ED. ED means impotency, erectile dysfunction. They are twice as likely to have erectile problem as men without diabetes. More common in men with hypertension, cholesterolemia, and smokers. In smokers. How does diabetes cause ED? By 5 factors, by 5 predisposing factors. By reducing blood flow ischemic to the genitalia, making it more difficult for a man to get or keep an erection. It is to initiate and keep two components. Sometimes initiation is there, but there is no duration. It is also ED. So initiate and maintain, durable. And then neuropathy, damage to the nerves, and it is 2 types. One is autonomic, different. Other is somatic, pudendal nerve, pelvic nerve. It can be damaged. Neuropathy is very common. Then testosterone is low. Now it is documented. It is called diabetic hypogonadism. Testosterone is low, and whatever is available, it is the quality is low in testosterone. Then iatrogenic, patient might be taking beta blockers high dose, non-specific, high dose of diuretic thiazide, iatrogenic. then psychogenic component is always there. So 5 predisposing factors for ED in diabetes. Can ED be prevented in men with diabetes? Erectile problem are more likely to happen when control is very poor. So first focus on the control. मरीज कहते हैं भाई कंट्रोल को छोड़ो, आप ये ट्रीट करो, आप नज़ला जुकाम ट्रीट करो, कंट्रोल को छोड़ो. अभी जड़ उसकी कंट्रोल है तो कैसे छोड़ें उसको? So focus first on the meticulous control of blood sugar. Keeping lipids and BP is also important because they will also predispose, as we have seen, ischemia and hypertension and all those things, prevent nerve and blood vessel damage. Smoking, very important. Drinking, equally important. Drinking, it causes neuropathy, including ED. Initially, after alcohol, everybody think of women. You drink alcohol, not you. Any person drinks, and the second thought will be woman. But it is libido. Eventually, it will cause nerve damage, it will cause liver damage, and it will cause impotency besides so many other complications. So alcohol is a toxin, I tell you. It is a toxin which some people drink for temporary pleasure. How is ED treated in men with ED with diabetes? It is important to first manage diabetes again and other linked condition like dyslipidemia and hypertension. First treatment is oral sildenafil type of drugs, Viagra, Cialis and Levitra. They work in about half of patients with diabetes. Dose may be higher. Other treatment, vacuum devices. After these, they are not very common but still available, good quality, will cost 50,000 rupees American imported, 10,000 from Taiwan, China. Sometimes they work. Intravenous injection. At one time they were very familiar, very commonly available in Pakistan, and I used to, believe me, thousands of injections at one time during some years on so many patients. Magic injection, magic. No problem. After Viagra, you have to think about, you have to stimulate first, then go to partner wife. But intravenous, no need of initial stimulation. It works anyway. Very Keverject, prostaglandin E1. But unfortunately, it is not available now because many patients are still there. They are not responding with PDE5 inhibitor. Phosphodiesterase 5 inhibitor like Viagra and Cialis, they cannot respond, or these drug can cause a side effect in them, palpitation, bharipan, hypo or hypertension, many problem. And with ischemic heart disease, it is contraindicated. And if patient is taking these nitrate group of drug, they may kill the patient. Many deaths occurred actually in those patients who were taking Viagra type of drugs along with nitrates, because both are potent vasodilator, sudden ischemia, death. So not safe drugs. In majority they are safe, but not in all. So intravenous injection, no problem, only local problem, maybe priapism, maybe hematoma, not very common. Magic injection, but nowadays price is 3,000 rupees per injection and not easily available. Okay, and prosthetic surgery. Many urologists, they are doing surgery. Cost is about 3 lakh rupees, including instrument. There are 2-3 types of prosthesis. Because of constraint of time, I cannot go into. These are all superficial. I didn't go in detail because of lack of time. Diabetes and androgen deficiency. Testosterone is the most important. Now we are coming to diabetic hypogonadism. Testosterone is the most important androgen in men and is needed for normal reproduction and for sexual function. How common is androgen deficiency in diabetes? About 1 in 3 men with type 2 diabetes have decreased serum testosterone level, more likely if they are also obese. Similarly, diabetes seems to be more common in men with low testosterone, other way around. Diabetes is more common in those who have got low testosterone and especially they are obese. So both ways. Symptoms of androgen deficiency are non-specific, vague, besides sexual dysfunction. Low energy level, थका हुआ रहता है, energy नहीं है, कोई spark नहीं है life में. Mood swings, कभी गुस्सा, कभी गम, कभी खुशी, कभी गम, इरिटेबल, डांटता रहता है बच्चों को, बीवी को स्पेशली, क्योंकि रात को बीवी डालती है, सुबह ये डांटता है। अच्छा, पुअर कंसंट्रेशन, वैसे ही वो सुबह भी डांट खाता है, वो 24 घंटे डांट खाता है बेचारा, बॉस की भी डांट खाता है, बिकॉज ही रिमेन डिप्रेस्ड 24 आवर्स अ डे। ओके, पुअर कंसंट्रेशन, रिड्यूस मस्कुलर स्ट्रेंथ, मसल दे डिपेंड अपॉन टेस्टोस्टेरोन। आप बोन देखें, मेल फीमेल बोन, ह्यूमरस, फीमर, you will come to know which is male bone, which is female, because more male female rough because of pull of the muscle, they are muscular, female smooth because muscle power is less. So men are muscular because of testosterone, so muscle strength goes down, low sexual drive, and maybe symptoms of androgen deficiency. Symptoms often overlap with many other illnesses. How does diabetes cause androgen deficiency? LH in brain is needed for the testes to make testosterone. ये तो कोई शक नहीं है. High blood glucose level can lower the amount of LH released and less testosterone may be made. Associated obesity may also lead to low testosterone. So diabetes, and now come to libido. Diabetic not only have got ED, premature ejaculation, retrograde ejaculation, but also libido. And I tell you, everything is important. Without libido, if you use Viagra type of drugs, sildenafil, it is only mechanical. Really, it is boring. ऐसे लगता है जैसे वो कोई ड्यूटी कर रहे हैं ना, no charm. Actually, this is the most क्या कहना चाहिए, pleasure है ना. खाना प्लेजर है, खुदा ने रखा है भाई, खाओगे नहीं तो एनर्जी कहाँ से मिलेगी, तो प्लेजर रख दिया है भाई। अगर ये नहीं होगा तो बच्चे कैसे पैदा होंगे, तो प्लेजर रख दिया। अगर ये ना हो तो कौन मैकेनिकल काम करे, बैठ के ख्वामखा थके आ रहे घर आते हैं, भाई नींद पूरी क्यों ना करें, मैकेनिकल काम क्यों करें। तो कुदरत ने इसमें प्लेजर रख दिया है कि भाई यू आर अट्रैक्टेड। और सेकेंड वर्ल्ड वार के बाद यूरोप में तबाही मच गई थी। उन्होंने फिर सोचा कि भाई अब हमें लड़ाई नहीं करनी है, हम दूसरों को मारेंगे, यूरोपियन आपस में नहीं लड़ेंगे, अभी हम खुशी मनाएंगे, अब ऐश करेंगे। कानून नाफिज कर दिया सबके लिए, प्राइम मिनिस्टर भी ट्रेन में सफर करेगा, कोई प्रोटोकॉल वीआईपी नहीं, कानून में सेफ्टी। एक तो कानून नाफिज कर दिया, फिर खाने पीने की ऐश कर दिए, जो खाओ पियो, कोई पाबंदी नहीं है, जितना अल्कोहल पियो, कोका कोला इतनी बड़ी पियो, परवाह नहीं। उसके बाद उन्होंने कहा भाई सबसे ज्यादा प्लेयर तो इस चीज में है, अब ये क्या करें। उन्होंने कहा ठीक है, अगर दोनों खुश हो तो करो आप, कोई कानून कुछ नहीं कहेगा। बच्चे भी पैदा करो, आपको इंश्योरेंस, ये अपना सोशल सिक्योरिटी के जरा फंड्स कम मिलेंगे, मगर बच्चे भी पैदा करो, परवाह नहीं। भाई हम बच्चे नहीं चाहते, मसले होंगे, चलो एबॉर्शन का वो कर दिया, ला कर दिया, कहीं भी जाओ एबॉर्शन कराओ, कोई नहीं पूछेगा किसका बच्चा है। प्लेजर करो, एंजॉय करो, बिशर्तिया दोनों राजी हो। अगर सख्ती करोगे तो सख्त सजाएं हैं, वो रेप वगैरह जो है वो बिल्कुल सख्त सजाएं हैं उसके लिए। राजी खुशी आप रहो, सबके सामने परवाह नहीं। इट्स अ प्लेजर, एक्चुअली दे वांटेड प्लेजर, हालांकि गलत है बहुत, मगर ये उनकी अपनी डिजायर है। इट्स अ प्लेजर, खुशी है ये। तो अगर लिबिडो नहीं है तो खुशी नहीं, इट्स ओनली मैकेनिकल। सो लिबिडो इज इक्वली इंपॉर्टेंट and it is testosterone. Okay, how can diabetes cause decreased libido? Low testosterone level in the men with diabetes can cause decreased libido. In men with diabetes and ED, the psychological effect of sexual dysfunction may decrease their interest in sexual activity. How is low libido treated in men with diabetes? Controlling blood glucose, again and again I am repeating, may help improve feeling of sexual desire as well. Target obesity, please. Obesity can exaggerate all the things. Men who have decreased libido due to androgen deficiency may need testosterone therapy. Testosterone therapy is indicated if there is strong evidence. Check for any other underlying physical or psychological cause. Counseling is helpful in addressing any psychological or relationship issues that affect sexual desire. Whatever the reason of ED or these sexual problems, counseling is always important because psychological component is very much there. Whatever the cause may be, it can be neurogenic, arteriogenic, atherosclerosis, but psychogenic component is always there. Thank you. So I finished before time, but I have to shorten my two talks, but basic idea, I tried to give you. Oh, now questions. زولوفٹ کے نام سے آتا ہے. زولوفٹ کا نام کیا ہے؟ سوری سیٹلین. ابھی جو پڑھایا سیٹلین, یہ اس پہ ریسرچ کافی ہوئی ہے. اسٹالوپرام پہ بھی ہوئی ہے. یہ SSIR جو ہے یہ نہیں, یہ تو دیکھو ویسے بھی تو ہم سالوں دیتے ہیں نا, تو کہ ہارڈ اینڈ فاسٹ رول نہیں, آپ مہینوں تو دے دو نا کچھ. ایکچولی دیز اینٹی ڈپریسنٹ ڈرگس دے اسٹارٹ ورکنگ آفٹر فیو ویکس. شروع میں تھوڑا بہت فائدہ ہوتا ہے, مگر ایکچوئل فائدہ شروع میں نہیں ہوتا. ایکچوئل فائدہ ڈوز بلڈ اپ ہوتا ہے آفٹر کپل آف ویکس. سو انسسٹ دیم. یہ کچھ دوائیں ایسی ہوتی ہیں نا کہ کچھ ہفتوں یا کچھ مہینوں کے بعد اثر کرتی ہیں. ٹیک ایگزامپل آف ہرسوٹزم. یو ہیو اسٹارٹیڈ 9:35. پیشنٹ نیڈ میجک ریمیڈی کہ بھئی ایک ہفتے میں بال ختم ہو جائیں گے. یہ رانگ. دیز ڈرگس اسٹارٹ ورکنگ آفٹر 3 months. So counsel them that you have to take for a couple of weeks before you see any response, and then continue. So long term. اچھا, ڈوز دیکھو ریپلیسمنٹ تھراپی ہے نا, یہ دو طرح کے آتے ہیں پاکستان میں. باہر تو کریم بھی آتی ہے, جیل بھی آتی ہے, پیچز بھی آتے ہیں. ویری افیکٹو, ناٹ ویری ایکسپینسو, اینڈ ویری کمفرٹیبل ٹو یوز. Here only 2 drugs are available. One is oral, other is injectable. Injectable is testosterone, oral is Andrex 40 milligram. Andrex کے نام سے آتی ہے. تو these oral 40 milligram 3 times a day is the full replacement dose of the oral testosterone Andrex, and 250 milligram deep intramuscular every 4 weeks is the average period. You can increase to 6 weeks. In hypogonadism you can decrease to 3 weeks, but average is 4 weeks. Any other question? Tired? After meal. Andrex should be taken after meal because it works through lymphatics, and lymphatics they are open after taking meal. So the mechanism is different. It is not wholly solely through the liver, partially it is through lymphatic. So always take after meal.
No side effect.
سائڈ افیکٹ دیکھو نا, تھیوریٹیکلی کہا جائے تو 2 سائڈ افیکٹ ہیں اینڈروجن کے. ایک تو ہے لیور ڈیمیج, دوسرا ہے پراسٹیٹک ڈیمیج. تھیوریٹیکلی تو 2 ہیں نا, مگر یہ پریکٹیکلی اتنا نہیں ہوتا. تو اب اف پیشنٹ ہیز گاٹ already deranged LFT due to any reason, then be cautious. اور بہت اولڈ ایج ہے اور پراسٹیٹ کا پرابلم ہے, اسپیشلی PSA بارڈر لائن پہ ہے, پھر اس کے باقی کوئی نہیں ہے. ڈیوریشن آپ کتنے مہینے وہی بات. یہ تو دس از ریپلیسمنٹ تھراپی. اب تھائروکسن کتنا عرصہ دو گے؟ لائف لانگ, کیونکہ ریپلیسمنٹ. انسولین کب تک دو گے؟ لائف لانگ. بھائی ہائڈروکارٹیسون ایڈیسن میں کب تک دو گے؟ لائف لانگ, بیکاز دیز آر ریپلیسمنٹ تھراپیز. کون سی؟ ہاں, رزلٹ نہیں ہے نا, تو ویکیوم ڈیوائسز سم ٹائم ہیلپ. اچھا, ایک دوا آتی ہے اس کا نام ہے میوس. ہاں, میڈیکیٹڈ یوریتھرل سسٹم اریکشن, میوس, MUAC. یہ کیورجیکٹی ہے, الپراسٹاڈول, پروسٹاگلینڈن E1, مگر یہ اسپیشل ایک بنائی ہے انہوں نے, مشین ٹائپ بنائی ہے, ڈسپوزیبل پلاسٹک کی مشین ہے, اور چھوٹے پیلٹ بنائے ہیں, بلکہ آج کل تو اس کی جیل بھی ڈراپ بھی بنا لی ہیں. سیم الپراسٹاڈول, تھوڑا سا ٹپ آف یوریتھرا اوپن کر کے تھوڑی سی پل کریں گے, اس میں وہ ڈال دیں, خود بخود وہ نیچے چلا جائے گا. تو یہ بھی ہے, دبئی وغیرہ میں اویلیبل ہے, اور کئی امپورٹ کر سکتے ہیں. پیشنٹ تو بہت سارے کہتے ہیں سر آپ فکر نہ کرو, دنیا میں کہیں بھی دوا ہو ہم امپورٹ ہم منگائیں گے, آپ لکھو صرف. تو میوز کا نام ہے, یہ بھی اویلیبل ہے, 2 فارم, ایک چھوٹی پیلیٹ اور ڈراپس. یہ انٹرا یوریتھرل ہے, انٹرا کیورنس نہیں ہے, چیز وہی ہے. اور میکینیکل یا سرجری پروستھیسس یہ کرتے ہیں, کراچی میں بھی کرتے ہیں کچھ یورالوجسٹ, اور ساؤتھ پنجاب میں بھی کئی ماہر ہیں کرتے ہیں. सॉरी, नहीं, बोन नहीं, ये स्पेशल मेटालिक इंस्ट्रूमेंट होते हैं। ये दो तरह के एक्चुअली होते हैं। एक तो ये है कि केवर्नस टिश्यू जो दो होते हैं ना, एक स्पंजियोसम है, दो कार्पस केवर्नोसम है, दोनों केवर्नस को खुरच देते हैं। उसकी जगह ये एक स्पेशल मटेरियल है, मेटालिक रॉड डाल देते हैं। अच्छा, इट इज फ्लेक्सिबल, नॉर्मली फ्लेक्सिबल है, और जब जरूरत हो उसको थोड़ा सीधा करके आप यू डू द थिंग एंड देन फिर वापस। एक तो ये है, और दूसरा जो उससे ज्यादा सोफिस्टिकेटेड है वो है छोटा सा पंप है, उसके 3 पार्ट्स हैं। एक स्क्रोटल सेक में छोटा सा प्लास्टिक पंप है, अच्छा, और 2 ट्यूब लाइक हैं, रबर ट्यूब विच गोज इनटू द केवर्नस टिश्यू। तीसरी एक वाटर टैंक है, स्पेशल वाटर है जो पेरिटोनियल कैविटी में होती है। अब आप उसको पुश करेंगे ना, तो पेरिटोनियल कैविटी के जो वो है बैलून टाइप जो रिजर्व है, स्पेशल पानी है, फ्लूइड हाइड्रोलिक प्रेशर से वो केवर्नस टिश्यू में ट्यूब में चला जाएगा, काजिंग इरेक्शन। जब खत्म करने का मोटो बटन है, बटन पुश करें वापस आ जाएगा, और ये परमानेंट होता है। मतलब ये नहीं कि आपको कुछ अरसे के बाद, ये महंगा इसलिए है ना, इट्स वेरी एक्सपेंसिव बिकॉज इट इज मेड ऑफ स्पेशल मटेरियल। जैसे पेस मेकर, ये स्टंट वगैरह परमानेंट पड़े होते हैं ना, ये इस तरह के मटेरियल हैं। ये दे आर मैन्युफैक्चर्ड टू बी यूज्ड फॉर ईयर्स इनसाइड बॉडी, ताकि इन्फेक्शन भी ना हो, इम्यून रिएक्शन भी ना हो। सो इट्स अवेलेबल, दीज इंस्ट्रूमेंट्स आर अवेलेबल। न्यूज अवेलेबल नहीं है, मगर दुबई में है अवेलेबल, और इंटरनेट पे जाएं तो एड्रेस वगैरह मिल जाएगी आपको। MUAC म्यूज किसी किस पेशेंट पे की है मैंने, हाँ बिल्कुल। ओके जी, ओके। In polycystic ovarian syndrome, देखिए, we begin with 500 milligram BD. Most we don't give very high dose initially. Rather, initially sometime we give 500 milligram one time a day, increase to 2 times a day. Maximum dose is 850 milligram 3 times a day. 850 milligram.
Thank you so much.
Okay.
Thank you very much.
Nice talk.